As I've done more and more liposuction, we've become more and more comfortable doing larger and larger volumes of liposuction, totally awake and keeping the patient totally comfortable. This used to be something that was impossible in the past. We're able to do moderate volume up to, in some cases, depending on how much fat we're removing, we can even do 360 all the way around the body with the patient totally awake, and then even do the skin tightening with Renuvion afterwards to get you the maximal result. So a patient walks in for small volume liposuction, they kind of go straight to pre-op where we're going to take pictures of all the areas that we're planning to treat. Next step is I sit with all of my patients. I mark all of the areas that we're going to treat, all the problem areas. I highlight the areas of anatomy that we're really going to try to sculpt out, and we agree on the plan. After that, we take some more pictures. The patient gets an MKO melt, which is midazolam, ketamine, and Zofran. That helps get you nice and relaxed before we go to the operating room. Next, some of our nurses are going to take you back to the OR, where you're going to get prepped with some cleaning solution. Then we're going to start what's called Pronox, which is patient-delivered nitrous oxide. It's a little different than at the dentist in that you control the flow. This lasts about 30 seconds, so if you get a little too loopy, you can back off, but it really helps keep patients' mind off of what's going on. Next, I'll put in some numbing fluid, or tumescent, which is how we do all liposuction. And then we wait for a few minutes in order to get nice and numb and get the blood vessels constricted so that we have minimal bruising afterwards. Next, you'll get gentle fat removal with small volume liposuction cannulas. We'll remove it evenly. I generally use power-assisted liposuction in order to assure that we're removing that fat evenly, and then we'll do a little bit of extra highlighting of the anatomic areas and contouring that we want to achieve. So after we're done with the liposuction, we do what's called Renuvion. I do this on all of my liposuction cases. This takes a few minutes at the end of the procedure. It's not painful at all. So after the Renuvion's done, we close the incisions. These are tiny, tiny little cuts that heal with basically no scar, and then you get compression put on and you're out the door. And next day we see you in the office, say you look great, no issues, and say you can go to the gym the next day.